Hi, my name is Bethany Ledden,
I'm Maddie.
I'm Naya.
I'm Jasmine.
and we are going to be presenting primary progressive aphasia, also known as PPA. What is PPA? It is a rare and underdiagnosed nervous system disorder that is characterized by shrinking of the lobes of the brain, which result in the loss of communication. This loss of communication cannot be contributed to other causes like head trauma or infection or stroke. It is a form of dementia, specifically frontal temporal lobe aphasia. Symptoms typically begin between the ages of 50 and 70 years old. Risk factors include learning disabilities and rare gene changes.
So, what makes PPA different from other types of aphasia or Alzheimer's? So, PPA's difference from Alzheimer's dementia is that Alzheimer's dementia is memory loss is one of the first signs, whereas with PPA, difficulty of language is oftentimes the first sign that is seen within patients that begin to have this degenerative disease. And when helping most clients with aphasia after a stroke, most times when you begin treatment, you expect to see improvements over time, even if it takes long periods of times to get there. But with PPA, it does proceed to get worse over time due to it being a degenerative disease.
So the effects of the brain. Primary progressive aphasia is caused by an atrophy of the frontal and temporal lobes in the brain, primarily on the left side of the brain. These lobes of the brain control speech and language. Scar tissue and abnormal proteins may also be present, and brain activity is also reduced. So here I have the arrows pointing to the frontal and temporal lobe of the brain where primary progressive aphasia occurs.
So these are some side effects of primary progressive aphasia. We have gradual onset. It happens gradually and then it proceeds to get worse over time, like I had previously said. So this includes difficulty speaking, naming objects, or understanding conversations. There can be problems with self-expression with language. Their memory can stay intact, especially during the first 2 years of decline, but then the difficulties start to proceed after that. They can also have difficulties reading and writing that will develop within time. Their speech can be slower. They have word finding hesitations. Um, their sentences can be abnormal within speech or in emails. Usually they'll have to have someone have their written phrases that they usually tend to say more often written down because later on they won't remember how to say them or they won't be able to express it. So they'll need it there handy for them to be able to like send a text message or to say to a loved one. They'll have substitution of words, so table instead of chair. They're using words that are mispronounced or incomprehensible, difficulty understanding what words mean, difficulty following a conversation despite their hearing being normal, forgetting the names of familiar objects, inability to think of names of people, even though the person is recognized, they know that person, and then they begin to have impairments in spelling as well.
All right. Primary progressive aphasia diagnosis. So there is no, I did a lot of research on this and found that there is no one test to diagnose primary progressive aphasia. It is characterized as relatively uncommon, and components of PPA evaluations can include the following: obtaining a in-depth medical history, and a lot of the times you'll get this from caregivers or family, close family, a neurological exam, a cognitive assessment, and laboratory measures. So they can also look at blood work, cerebrospinal fluid analysis, and they can do brain imaging like an MRI or PET scan to see what's going on. I also did find that the Western Aphasia Battery Test has been known to be a useful tool in characterizing which PPA subtype a person has, and I think we're going to get more in depth in the other slides.
So there are three subtypes of primary progressive aphasia. These aren't specifically in order of getting the first one first and then the third. It's just kind of dependent on which one a person ends up having. So there's PPAG, so which is agrammatic non-fluent subtype, PPAS, the semantic subtype, and PPAL, which is the logopenic subtype. So the first subtype is agrammatic non-fluent. From what we've learned in class, obviously, reduced speech, and the effort and the quantity is very much reduced. So there's not going to be any more than 3-4 words that are said. Sentences become shorter and words are left out. So word order may be abnormal, especially in writing, emails, messages. They may be mispronounced or used in a reversed form. And understanding single words is preserved, but sentence comprehension suffers if the sentences are long and grammatically complex. So typically with these types of patients with agrammatic subtype, we're going to see very short, to the point phrases that are going to be said to one another, and we won't typically get much speech out of them. So the second subtype is semantic subtype. The person may seem to have forgotten the names of familiar objects, of loved ones, of everyday use objects that they see around. Single words are misunderstood, even if they are common words. When they're asked to bring an orange, for example, the person may appear confused and may ask what an orange means. However, when they're given that orange, they're going to know that it's something that you can eat. So not understanding like the categories that items go into. Speech is often fluent, but somewhat it's empty. So filler words and phrases are used more frequently. So this is the type of patients that maybe we see that will talk more, but there's not much meaning or comprehension that is said within their statements or phrases. And then the third type, subtype, is the logopenic, and that's individuals have difficulty recalling the names of objects and or thinking of words in conversation, but they understand what those words mean. So they're going to substitute a different word for one that they cannot find. They may use a simpler word or insert fillers. So they're going to say something like the thing that you use for it, you know what I mean, or whatchamacallit. So they can picture it in their mind and they know what it does, but they just can't find the word to be able to explain to you what it is. So speech is fluent for casual small talk, but it can result in mispronunciations and word finding pauses when speech becomes more complex or more precise or difficult words need to be used for a conversation to continue. Also, individuals may have difficulty repeating phrases or sentences.
Okay, so now we're going to get into a little bit of the treatment and management. Treatment, currently, there is no cure for primary progressive aphasia. However, some therapies can help maintain the ability to communicate and manage someone's condition. So even though there's no cure and it will progressively get worse, you can maintain it for a period of time with different therapies. Some management, a speech language pathologist can be helpful for maintaining language and communication skills, and cognitive behavioral therapy has also known to be helpful. And there are some instances that antidepressants are given, such as selective serotonin reuptake inhibitors, or SSRIs, are to manage behavioral changes and reduce anxiety or depression associated with PPA. And then some most effective communication strategies. In early stage PPA, the clinician often focuses on rebuilding impaired communicative abilities, such as restitutive treatments. Research shows that treatment during mild stages is critical for helping clients relearn lost skills and even slowing the rate of decline by promoting maintenance of communication abilities. There's also nonverbal techniques for communicating, such as having the person gesture or point to pictures. This may help people with PPA express themselves even though they cannot get their words out. So they still feel like they're communicating. And then there's also a focus on communication partner training and environmental modifications, like making a communication book a patient can point to in order to communicate. Or there are also a bunch of other AAC devices that can be helpful in having someone with PPA be able to communicate with things other than their words. So,
Okay, so the role of the SLP, obviously, as we know, typically when you have a patient with aphasia, you're gonna want to treat them for memory, be able to recall important things that are important to them. And that's kind of like the basis of also the role of an SLP with for treating a patient with PPA. They typically have 5 different domains that they will encompass. So we have behavioral assessment. So they're going to do an assessment on the patient, see what's going on, what are the main concerns, what do we want to address first, and then work from then on. And then we're going to have intervention. So we're going to start our treatment progress. We're going to introduce compensatory strategies. These are going to be strategies that are going to help out a patient when they need help with certain phrases, certain words, being able to recall different words or phrases that are important to them that they would like to communicate to their loved ones. And as Maddie was saying, communication partner training, we're going to introduce loved ones that are going to be there for them to help them get their words across and be able to communicate. And then informational counseling as well. As an SLP, we have a job to our patients to be able to provide the best treatment options that we can, but also be there for them emotionally when they need it. PPA is a rare, but it can happen, degenerative disease over time. They understand that they're going to be losing all of these abilities that they don't. Obviously, I mean, no one wants to lose the ability to be able to recall words or be able to talk to their loved ones. So you have to be there for them, not just through providing them language treatment opportunities, but also be there for them emotionally when they need it, and their loved ones as well. So some different areas that an SLP will mainly target with a patient with PPA is practicing priority vocabulary. So practicing that vocabulary that the patient uses on a day-to-day basis, that's most important to them. So an example would be like making sure that they can remember their family members' names as much as possible. So we're going to have cards with their faces on them, and they're going to try to name their family members as best as they can and keep doing that, because that way they can be able to recognize who is who. We can teach scripts for patients. So in early stages, when a patient discovers that they may have PPA, their family members can be tasked with writing down important phrases that are used in everyday life, So if they say different words, like different catchphrases, if they call a loved one every day and they say this or they say that, that's something important to that patient that a family member can write down, so later on the SLP can be able to target that for the patient. And we also have training compensatory strategies, so we can have a family member at home label items around the home that are important, like food, um, in the bathroom, if they use moisturizer, toothbrush, toothpaste, just being able to label those for them to know what each item is in their environment. Then this one was really interesting to me. So creating a PPA business card. So this is just an individualized information card that a patient with PPA can carry around later on when they know they won't be able to communicate as well with others in the community, in the environment that they're in, whether that be a grocery store, a library, a restaurant. That business card just lets that other person know that they are struggling. This is what I have, so this is how I won't be able to communicate as well with you, but I will try my best and just be patient with me. So I think that's really important for them to be able to have that and carry it around. So we're going to train nonverbal communication at a point in this disease. There will be a point where there will no longer be communication. So we want to also be able to train nonverbal communication later on when language is limited, and be able to provide a patient with those nonverbal gestures so they can have as well. And then AAC is also something Maddie talked about, and just planning for the future. Each time your patient comes in, you want to plan for what's next, what's ahead. Because this is a degenerative disease, you always want to be able to be ready for what's to come and have a plan of action for that when it happens. So, yeah.
Bethany, you're on mute.
Activities for those who with PPA are communication modalities to bypass those speech difficulties, like the language therapy app, where you can insert custom words that are important for the client to be able to use. It's important to assess the swallowing difficulties as the disease progresses, because it is a degenerative disease. Physical activities such as yoga and walking that do not require language can be nice for those with PPA. And then musical activities. Those with the PNFA subtype of PPA can sometimes sing better than they can speak. And then puzzles such as Sudoku and Jigsaw are really helpful.
Okay, so some goals for the client. This goes along with the role of the SLP, but what we want is just effective communication, having that communication get across to the other person that the patient is wanting to speak to. Obviously, we never want perfection for any of our patients. We just want communication to be understood and be effective. So the SLP is gonna provide an early treatment plan that's personalized for that patient, have that communication partner training and planning for the future, which is really important. An SLP should assess current impact on communication, and then identify the priorities of the patient, develop that treatment plan, and focus on those compensatory strategies while also creating a home program for a client to preserve their skills as long as possible. We know that therapy is only as effective if a client is also working on their skills at home and doing the best that they can to retain the skills and retain their language as long as possible.
Okay, this is a small share about primary progressive aphasia. So to someone who is new, does not know what it is, This is just a summary. Says primary progressive aphasia is a nervous system syndrome that affects the ability to communicate. People who have it can have trouble expressing their thoughts and understanding or finding words. So, a few signs and symptoms: we have trouble comprehending spoken or written language, trouble comprehending the meaning of words, trouble naming objects, not being able to formulate sentences. So, when to see a doctor? See your healthcare provider if you have concerns about your communication. If you know someone who has symptoms of primary and progressive aphasia, suggest they see a healthcare provider. If you notice changes in speech or communication, call 911 immediately.
And yeah, these are references, and thanks for tuning in to our presentation about PPA.